Thank you. Good afternoon. My name is Christina Dietrich, and I represent Delaware Medical Freedom Alliance. I have 4 children, including 14-year-old twins. I live in a low-income, majority-minority neighborhood in Middletown, Delaware. I also work in home health care. My sole patient for 9 years has a neuromuscular disease and a tracheotomy and is obviously a very high risk for COVID complications. My family therefore took extreme precautions to avoid me bringing the infection to work, including homeschooling. I even made my husband, an Amazon worker, shave his beloved beard. My parents were both hospitalized with COVID in April 2020. The high effectiveness rate of the vaccine seemed very exciting. After the vulnerable people in my life had been vaccinated, I allowed my children back to normal life. As their mom, I decided the socio-emotional benefits clearly outweighed the incredibly low morbidity and mortality from COVID-19 in healthy kids. As I began to consider vaccinating my children, I called the CDC mid-May to inquire about myocarditis and other adverse events. I asked if an emergency ACIP meeting might be called before children 12 to 15 started getting their second doses. Why can we not wait for a BLA? As Dr. Cody Meissner pointed out at the FDA meeting on June 10th, the current COVID pediatric hospitalization rate of 4 per million certainly does not constitute an emergency. Nearly half these children had a positive test that was only incidental to their hospitalization, and 7 in 10 hospitalized for COVID had at least one comorbidity. Your own charter states that you will advise on population groups and/or circumstances in which a vaccine is recommended. Healthy children are not the same as kids with risk factors. I fear that your risk-benefit balance fails to take this into account. I'm also not compelled by the argument that we need to use kids to constrain community spread. It is unconscionable to ask a child to risk his health in order to protect adults. Human beings hold the welfare of our children and the health of future generations paramount. The WHO, UK, Germany, and others have all declined to recommend this vaccine for all children. I thought the USA was the standard bearer for safety and evidence-based medicine. Seroprevalence for COVID-19 antibodies in children is 27%. Why ignore natural immunity? How can universities mandate a vaccine under EUA when the federal government is barred from such a mandate? Would young people be as willing to use this product if they knew, for example, the odds of winning a serious adverse event exceeded the odds of winning a state-run lottery prize? Is it ethical for the CDC director to use out-of-date and improperly contextualized hospitalization data to frighten parents into vaccinating their children? Primum non nocere, first do no harm. In other words, don't just do something, stand there. Recommendations should not be based on conjecture, nor should they be political, made to protect pharmaceutical companies or to manipulate public opinion. Trust in our public health apparatus has declined precipitously. Any risk has been downplayed by government officials with the slogan of safe and effective, which violates the spirit of informed consent, if not the letter of the EUA.
Thank you for your comment. Your time has expired.
Updating your guidance in light of the adverse events in the mRNA vaccines in young Americans will go a long way towards increasing trust in the future. Thank you very much for the opportunity to speak.